We're expecting word any minute from the FDA on a decision to approve or to turn down a female version of Viagra. Now, this would be the first FDA-approved drug to treat a lack of sexual desire in women. It comes in a little pink pill, and the FDA twice turned down this medication since 2010, citing side effects, but now it's deciding if the benefits outweigh the risks. So let's talk more about this with Dr. Philippa Cheetham. She's a urological surgeon and cancer specialist. Also with us, Dr. Judy Kuriansky, who is a clinical psychologist and certified sex therapist. First, to you, Dr. Cheetham, let's talk about how it works, because it's a little different than the male version, right?
It is, and although we're hearing that it's been marketed as the female Viagra, it's working on very different receptors in the brain, and it's working on a receptor called 5-HT serotonin, which many of the antidepressant medications that are out there now work on these receptors. And it's kind of interesting that in 1991, when we discovered Viagra, it was marketed initially as a medication for blood pressure, but they found that men who took this medication for blood pressure had great erections. This drug for women,
that was the side effect.
This drug for women was actually initially developed as an antidepressant in 2006, and they found that in women in the study, they had improved sexual desire, in the women only, actually.
Dr. Judy, should it be approved?
Well, you know, we've been looking for a pill for women to help their sex desire so often, because I have seen so many of these women over so many years, and they're in such pain emotionally, that they can't get excited.
Intimacy is important in a relationship.
Well, exactly, and that's exactly the point, that it's the intimacy and the love that really matters to women, not taking the pill that's going to affect their brain. And as Philippa was saying, it's really difficult and dangerous, I think, because this is a medication that is affecting the brain. The male pills that they're calling the blue pill of Viagra is really affecting the male sex organ, pushing blood there so the man has an erection. Here we're talking about chemicals in the brain. That worries me, because women be rushing to have it. As we just heard, it's related to depression and treatments for depression. So what if you're not depressed? And you have to have, so importantly, a psychiatric evaluation for your total medical condition.
What about those risks?
I think one point we must have to make here, it's not a one-size-fits-all. And we know that the definition of female sexual dysfunction is in women who have no desire for 6 months or more, that this is causing significant distress, as Judy has already emphasized, and that there are no other factors, like no relationship factors, no hormonal factors, no medical factors, but we know it's multifactorial, and it's very difficult.
But what about side effects?
Well, I think the side effects have been shown in studies for this group of drugs to be overall mild side effects, but side effects that we know, CNS side effects, central nervous system side effects, are nausea, fatigue, in some people difficulty sleeping, insomnia, dizziness. So these are very non-specific symptoms, but in most women, they actually are not stopping them taking the drug. Is that fair to say?
I think it's really important that women do not rush out if this gets approved and say, I want to be the female stud, you know, I want to have sex for so long, I'm going to be so much more attractive. Women are so insecure, sadly enough, about their sexuality. I want them to feel already confident, already good about where they are. We've been spending so many years as sex therapists saying, feel okay about who you are. If you increase your self-esteem, have a better relationship, as Philippa was just talking about, and as you mentioned, Anna, and if you feel that you are loved, that you are beautiful, that your sex desire is okay, work on the psychological things before you start working on the brain.
I have to say, too, because I'm kind of skeptical, right? I mean, is this about money and the pharmaceutical industry making big bucks, or is this really a medical breakthrough?
Well, the first thing you have to remember is that many, many women are taking pills for antidepressant already, and they're trying to fight depression that affects hormonal levels, and here's another pill that can fix another problem. And if you're not careful, you could be taking so many pills when you need to look at what you're putting into your body, your diet, your lifestyle, your relationships, and this pill is not just a quick fix.
Well, ladies, good to have both of you to talk all about it. You've been warned out there.
Please don't rush.
On store shelves. Just take it with caution. Dr. Philippa Cheetham and Dr. Judy Kuriansky, thank you to both of you.
Okay, thank you.